I'm David Cohn. I'm the director of the Division of Gynecologic Oncology at the James Cancer Hospital of The Ohio State University. As a gynecologic oncologist, we treat cancers of the female reproductive tract, like cancers of the ovary, of the cervix, and of the uterus, as our three most common malignancies. These are cancers that are very often treated with surgery, hysterectomy, and in certain circumstances may require chemotherapy and radiation therapy as well. I chose the specialty of gynecologic oncology because I really felt that I identified with the patients with whom I care. In my training as an obstetrician gynecologist, I realized that the breadth of OBGYN was a little bit too big for me, and I wanted to know something about a very specific field. And so I enjoyed the concept of taking care of the patient from a surgical standpoint, providing chemotherapy to her, and also providing primary oncologic care to our patients. So I find that I'm able to identify with a lot of what the patients are going through, and it's been a truly rewarding experience. When a patient comes to see me, my goal is to treat the patient as if I'd like to be treated myself, or like I'd like to see my family member being treated for her cancer. So we take a very personal touch and a very personal approach to patient care in our group. We think it's really critical that we look at the patient as an individual. We recognize that there's no cancers that are alike between patients, and that every patient's different herself. So our care philosophy is making sure that we take holistic care of the patient in a very individualized fashion. The most rewarding thing for me as a gynecologic oncologist is being able to treat each patient as an individual. When she walks into the door, we know she may need chemotherapy, radiation, surgery, but being able to contribute to the patient's care through her journey provides me with a lot of satisfaction.